So in last class we discussed about what is communicable diseases, how they spread, ठीक है ना? This and the system of spreading the communicable disease is known as dynamics of communicable disease. Okay. Now in this class we will study about how we can prevent and control the communicable diseases. Okay, and it is very important in community that we should be able to prevent and control communicable diseases. These are two words, okay, prevention and control. When we say prevention, it means the measures that are applied to prevent the occurrence of disease in the community. Okay, means presently it is not in the community and still we are trying that it should not come to the community. So these measures will be known as preventive measures. And when we discuss about the control, it means that the measures that we apply to prevent the transmission of disease after it has occurred. It means there are some cases in our community, say 2 or 3, we have identified. Now we want that this disease should not spread to another person. Okay, disease has occurred, but we are able to control it. We are able to confine it to the less number of population. Okay, so those measures will be known as control measures. Okay, so slight difference will be there in preventive measures and control measures. Okay, but sometime mostly the measures are same. That's why we call it tell the prevention and control measures. Okay, in one question we can ask this. Okay, so the prevention and control of communicable disease involve interventions which help to break the chain of infection. Okay, we have already discussed what is chain of infection. There are 6 links, and if we are able to strike any one link or break any one link, we can prevent or control the disease. Okay, so we can break the chain at 3 levels. Okay, number 1, at source level or reservoir level. From it starts spreading, we can control at that level, and sometimes we can control at mode of transmission level. Okay, we can prevent transmission. And third one, there are some measures which we apply at the susceptible host level. Okay, so at these 3 levels we can apply some measures to prevent the disease or control the disease. So what are the measures that we apply for at the source or reservoir? Okay, here we should see that prevention and control measures that are applied for the source are applied only when we are able to detect or identify the disease that it is in the community. Okay, and they also depend upon the type of source, okay, or reservoir. Preventive and control measure include the following activity. What we will do in the preventive and control measures? First important aspect or preventive measure is we have to diagnose the disease. Okay, the early we are able to diagnose the disease, the early we can start the measures to prevent or control. Okay, so first intervention is diagnosis and treatment. First of all, we should be able to diagnose and treat the cases of the disease, and sometimes we can refer the patient for the treatment to higher facility and reduce the time of exposure. Okay, if we are able to identify the cases, for example, there are 2 cases now of tuberculosis and we have identified and we have started the medicine, then these 2 will not spread the disease to another. But if we are not able to diagnose them, they will stay in the community, they will spread 2 to 4, 4 to 10, any amount of cases may be there. So the first measure will be early diagnosis and early treatment for the cases. Okay, if we are able to do that, we can prevent many diseases, many cases of the community. Okay, first measure is diagnosis and treatment. Second is screening. Okay, this system or this process is done to identify the cases. Okay, screening refers to detection of an infection in an individual who does not show any sign. Sometimes client may not show the sign, but we screen them, as we have done in the COVID. How we screened? We just check all the patients who are coming to the center that the client is suffering from fever or not. If he is suffering from fever, then we send for the diagnosis. So these are known as screening test. Okay, and for each disease we have some screening test. For tuberculosis, what we use for screening test? Chest X-ray, and then for final diagnosis, sputum examination. So we can screen if we are able to screen, because during screening we can detect a large number of population, and in that we can find out some cases actively. Okay, so screening is also a very important process or activity for prevention and control of communicable diseases. Then next, isolation. This method is also applied at the source level. If we are able to diagnose and if we start treatment, even then we have to isolate the client for certain period. Okay, till that, if his disease is communicable, or if he is able to spread the disease, we have to contain the client to a particular place. This is known as isolation. Okay, for the period of communicability. Okay, we will isolate the client, and if we isolate, the client will not be able to spread the disease to another person. Okay, so these three points: screening, isolation, and third one is early diagnosis. These points are used at the source level or reservoir level to prevent the disease. Okay, another one, reporting. This is also at a source level. Okay, reporting for many communicable diseases. Okay, our higher authority sometimes say that for tuberculosis or for measles, if you find such cases, immediate report. Okay, so we report, and through reporting, our higher authority are able to apply some control measures for the disease. Okay, so reporting is also very important. So this is the fourth measure which we apply for the prevention and control of the disease. Then one more important measure is there, culling. What is culling? Culling is killing the source. Okay, we destroy the source so that they cannot spread the disease. It is applied only when the source is animal. If the source is human being, we cannot kill. Okay, but we can kill the animals. For example, in case of bird flu, mass culling is done for hens and other birds. Okay, also a measure to prevent the diseases, communicable disease especially. Okay, so these are the measures which we apply at the source level. Okay, so 5 points we can write at the source level. Now at the mode of transmission level, here we try to prevent the transmission of infection. Okay, what we will do here, it depends on the mode of transmission. The activity at this level depend upon the mode of transmission. For example, if the mode of transmission is direct transmission, okay, when the mode of transmission is direct, means by touching or by sneezing, then what will we do? We do some measures which prevent the direct transmission, and these measures are: number one, social distancing. Okay, as we have done in case of COVID. Okay, so distance should be made. Then hand hygiene. Okay, frequent washing of hands. This is also measured to prevent. Then respiratory etiquettes, sneezing like this. Okay, or using hanky, and using mask and avoiding crowding places. So these are the measures by which we can prevent direct transmission. Okay, so this is the measure at mode of transmission level. And in case of indirect transmission, if the mode of transmission is indirect, then we act on the vehicle, means through which the organism is passing. Okay, for example, If it is passing through water, then we will do water purification. If it is passing through food and milk, we go for food hygiene and milk hygiene. Okay. If it is through vector, then we go for vector control, like control of mosquitoes, etc. Okay. Then special attention should be paid during the treatment of these patients to prevent transmission of infection to healthcare providers and then other patient. Okay. First we should protect our health workers. Okay. For that, what we can do, we can ask them to use mask, gloves, okay, or even personal protective kits, PPEs. Okay. So in this way we protect our medical personnel, and then we go for. So we should protect our health workers, and then to the case patients and other common people. Okay. The measures for next preventive measures are at the level of susceptible host. Okay. Here we protect host. How we can protect them? By increasing their immunity. How we will increase their immunity? By vaccination. Okay. So we go for vaccination, as we have done in the COVID cases, and even for children we provide vaccines to protect them and to increase their immunity against the diseases. Okay. So vaccination refers to the administration of vaccine to increase resistance of the susceptible host against specific vaccine preventable infections. Okay. So this is also a preventive measure in case of susceptible host, at the level of susceptible host. And sometimes we provide chemoprophylaxis. Okay. What is the chemoprophylaxis? It means we give some medications before starting the disease. Okay. If we give medication after disease, it is known as treatment. But if we give medication before disease, then it is known as chemoprophylaxis. Okay. For many diseases, we can give chemoprophylaxis, such as when our health workers visit malaria endemic areas, then we give them prophylaxis medicine, chloroquine are given to the staff so that they are protected. So this is known as chemoprophylaxis. Okay. So this is also a measure to prevent infections. And then last one is maintaining healthy lifestyle. Okay. We explain or we spread awareness that if you are maintaining healthy lifestyle, your overall immunity is increased. Okay. For example, good nutritive foods, daily walking, jogging, daily exercise, less smoking or stop smoking. So these points can raise our general health, and disorders or communicable disease are prevented. Okay. So these measures increase our resistance to the infections. So in this class we have discussed mainly how we prevent and control the diseases. We prevent and control disease at 3 levels. Okay. Some measures at host level, some measures at mode of transmission level, and some measures at the source level. Okay. So in this way you can remember and write your answer. Okay. Thank you.